At Mayo Clinic, we take a very holistic approach to our patient care, putting the patient first. The needs of the patient are the really only needs that should be considered. And as part of that, we feel very strongly that we want to harness the talents, and particularly the creative talents of members of our staff in the field of innovation. And in innovation, we recently actually developed an innovation program that is really in 4 parts. The first is artificial intelligence, but we now call this augmented human intelligence. And we're taking advantage of big data sets that we have at Mayo Clinic. For example, the electrocardiogram, to a very simple thing, the EKG, to make additional diagnoses that we've never thought about making before. So a computer can make that diagnosis for us. This improves the prevention and particularly the diagnostic accuracy and also therapeutics. We also have programs now developing on virtual or augmented reality. This is very, very exciting. This has potential for improving educational and for training of particular procedures. The third thing that is in our innovation program is looking at development of biologics and drug innovation. So for example, developing drugs that particularly target the treatment of heart failure. And the last thing that we also are helping develop are new devices, novel devices that we think will also help our future patients. And so, for example, developing devices that may be able to be inserted maybe percutaneously to close off the left atrium to prevent blood clots forming there and causing damage, for example, with strokes. So again, these are exciting times, exciting therapies and diagnostic tools that we can provide to our patients in the future. 15 years ago, I was connected to Professor Mara by a mutual friend of ours and former mentor of both of us, particularly mine, and his name was Dr. Vlietstra. And we had this vision of having this bridge over the Atlantic that would provide a joint collaboration between Mayo Clinic and the hospital and university group here in Torino. And the idea was that we would share ideas, share our clinical practice, talk about the challenges that we both experience. And interestingly, the success of Mayo Clinic, one of the reasons for that was the willingness and the importance that the Mayo brothers placed on traveling to other cities, and particularly to overseas cities. And they did many, many travels at the beginning of the 20th century. You can imagine that was quite difficult. They have to go on a ship. So when we come to places like Torino, sure, we'd like to share what we think are good practices in our own institution. We talk about the challenges that we have, but we also learn about the challenges that are faced here in Italy. But we also learn things. It gives us a different perspective on diseases, and we can go home and I can tell you that sometimes we have incorporated things that we have learned here in our own practice. We've also had some research fellows who've come from Torino and have come to Mayo Clinic for a few weeks or a few months and have also been very successful. So it's something that over now 15 years, this is the 14th year of the actual meeting, this has continued to be very successful, and I think the success is appreciated mutually by both us and here in Torino. The future of cardiology, I think, depends now on, number one, prevention of disease. We don't want to see patients, but when we have those patients, I think the future of cardiology is that we need to improve the accuracy of diagnoses. We need to eliminate uncertainty in the diagnosis. We need to be able to streamline therapies, whether they're drug therapies or invasive therapies, to be the simplest, the most cost-efficient, and when it comes to invasive procedures, making them as less invasive as possible. And then I think it gets back to my early comments about innovation, how we can incorporate the remarkable things out there in the non-medical world, as I said, for example, artificial intelligence, augmented reality. How can we employ those to help our patients now and in the future? I think that's really what the future holds for us. I think it's going to be very, very exciting.